All right, so this is Dr. Chadi Nabhan, and this is what happened. I sent a text message to Chadi yesterday. I said, Chadi, um, I need for you to do me a big favor. Can you speak tomorrow at the diversity conference? And Chadi did not even say no. Without batting an eyelid, he said yes. And so that is the power of a great friend like Dr. Nabhan, who um, is a well renowned author. He's written on uh, big industry exposing patients to, or potential patients to toxins, and specifically talking about Roundup and how the consequences of those could be significant. Then he most recently is written on patients' journey in the cancer space, helping patients navigate this space that we take for granted. In addition to that, Dr. Nabhan was a member of the ASCO Disparities Committee for 3 years, in just a very well regarded friend. And if I was to go through his CV, I guess we will not be finishing. But Chadi is not here for platitudes today, right, Chadi?
No,
Um,
I'm not. I'm here to earn my invite as your first choice next year.
But Chadi's other role is that he's a member of the editorial board of JAMA Oncology. So he's going to put on two hats because he's a treating clinician. He also has worked with industry. And what I want Chadi to be able to talk to us today is putting on both hats, treating physician and editor of a journal. And the question is from a journal's perspective and also from the perspective of a treating clinician, how do medical journals present data to us so we can digest it and understand it and know the representativeness of the studies instead of going to the supplemental appendix, page number 40, to find it? So, Chadi, thank you so much for being here.
No,
And
thank
please
you.
talk about your books
Well,
as well.
I'm frozen, I think. Can you hear me?
Yes, we can hear you.
Okay. Well, thanks, Remu, for the opportunity, and sorry I couldn't make it in person. Also, congratulations on really getting this going and having a lot of people talk about such an important topic. I guess your question is more from the biomedical journal standpoint, specifically journals maybe focusing on cancer, and how we would like the data to be presented, if I understood your first question correctly.
Yes.
Um, I think the best start is just to differentiate between two types of research. I mean, as a journal, you are going to receive some papers that are specifically focused on diversity and disparities research. But there are some papers or investigations or original contributions that this is not the main focus. They're talking about newer therapies, prognosis, predictive markers, things of that nature. But there's obviously a disparities component in it. So I probably would like to think of this in two buckets, because I do think there's probably opportunities in each one of them. So in the second bucket, when as a journal we receive a submitted paper that is either talking about novel therapies or, again, in any disease, I think we can all agree that it is critical to put this in the context of the applicability of this research across the demographics or the US population, or even depending on which population we're talking about. Look, Rimu, and every paper, if you ever submit a paper to any journal and you do not have one or two paragraphs talking about the shortcomings of the paper or the limitations of the research that you are doing, the reviewers are going to send it back and say, well, can't be that perfect. Let's talk about the shortcomings, right? I mean, I think it's very important. And in fact, it's almost, it's a teaching point to any students, residents, or fellow writing a first paper, make sure you have that limitations of your research. And I think it's very important that today that some of these limitations should acknowledge the fact that maybe my investigation, my paper did not address the broader population in the US that represents all demographics, unless it did. Now, if it didn't, we should really ask from writers and authors to explain why. And I think that's important. Sometimes you try and you're unable to get that inclusivity, and there may be some reasons. It could be that you have a particular biomarker that is just very rare in particular patient population. It could be that the research was conducted in a country where the underrepresented minorities or in a state could be only less than 10%. But it's important to surface that. It's important to ask authors to tell us, great research, great paper, great findings, tell us why this particular investigation was not successful in enrolling patients of various races and ethnicities. And I think we should be humbled when we just see that they tried and they weren't able to, and that's really why. So that's very critical. And like I said, it should not be in the supplemental thing. It should be part of the limitations or shortcomings of the research paper. The other thing is, as an editor, when we look at the particular research investigation, is understand the clinical applicability of that research broadly. So is that paper that you are actually wrote, does it really apply to what is going to happen the next day when you are a general oncologist, hematologist in practice and seeing various patients? And it should be out there. The third thing that I think it's important is to think about the confounding factors that might affect the interpretation of the paper. Two other comments, Ruemu, I'd like to mention. I think we see as editors and a lot of research papers that are highlighting the problem, right? And I think that's great and dandy and wonderful and amazing, but I think we all know the problem at this point. And I would like to see more papers talking about solutions. I get the opportunity as member of the editorial board of JAMA Oncology to review a lot of papers, and we get to decide whether some of these go for peer review and not. And I do think that we are much less interested in papers that just telling us the problem, because everybody in this room and other rooms know the problem, and we really want actionable opportunities. What can you actually do to resolve the issue? And the last comment is, I get actually a lot of heat about this, and I get a lot of folks who criticize me about this. I'm actually a big proponent of real-world data and real-world evidence. I do acknowledge there are limitations sometimes to what you can do in prospective clinical trials or randomized controlled trials. There are certain elements that you just out of your control. You try, but it's out of your control. And because of that, sometimes we should actually encourage, as on the editor side, it's okay to look at some observational studies, some studies from a real-world evidence, real-world data that are looking at disparities and outcomes and things of that nature. I think it's a long-winded answer to your question, but hopefully this highlights a little bit how I think about this. The last comment, I think I said the last comment 2 comments ago, but the last comment is, I mentioned this is if you have a paper not talking about disparities research, but there are papers that are specifically focused on disparities research, right? This is the actual theme of the paper that is being submitted. I mean, again, so we get editors, we receive papers. This is the actual thing. It's not about a new treatment or things like that. And these are very important. And when I see a paper like this, I pay attention a lot to the methodology. I mean, you have to pay attention to methodology in any paper, but specifically with disparities research, tell us how you got the information from, which registry you got the data from, how accurate is the actual data that you are claiming that this is the race, this is the ethnicity, and so far. Ethical consideration are really critical. I'm sure many of your speakers have highlighted the cultural barriers sometimes in clinical research. And we have to acknowledge the elephant of the room and then try to think together how we can actually improve this forward. So disparities research is actually key, and I think transparent reporting as an editor is very important to me to make sure that this is actually what's going on. Put everything for us, tell us everything, be very clear about the methodology, the ethical aspects, the supplementary tables. We want to know it all because this should show us the opportunity and the effort that was made to address the question at hand.
So great answer, Chadi. So I'm going to push it a little bit further, right? So of course you know about our drive score, and
Yes.
one of the reasons why we created a drive score is that when you read a paper and you say ECOG performance status is 2, everyone knows what that means. The problem is that when you look at a paper in a journal, there's no way of immediately knowing what the representativeness and therefore the generalizability of the data is. And so we are insisting at least that our score, or any other score for that matter, should be used in a way that is so simple that the treating physician, when they read that data, they know what the representativeness of that is. And why could that be important? For example, if there were two drugs that were treating the same disease and one had a score that was more representative, maybe clinicians might choose that. What do you think about a journal like JAMA Oncology or any other journal adopting such a strategy?
Yeah, I mean, I think absolutely. I mean, I agree with you. There are so many other strategies that also we need to think together how to adopt. I mean, I don't see any downside to this strategy. I actually see a lot of upside, and I think it helps us understand more about the data that we're trying to interpret. But Jimmy, there are so many other strategies that I believe journals, JAMA Oncology, and others that could actually adapt that are going to help. And it starts from even on the editorial board. Do we have representation on the editorial board of physicians and administrators that are diverse, and are we inclusive to make sure that we can hear a lot of opinions? Because there is sometimes bias if you are a peer reviewer, and we have to acknowledge that we need to work together on eliminating this bias. So as a peer reviewer or as an editor, that is no longer a factor. So having a diverse editorial board is always key, and I think that is important on all the journals, obviously. And I think we've done a very, very good job at JAMA and College to make sure that the editorial board represents diverse folks. I also think there's a couple of things I like to see journals doing, and I don't know if you agree with me. Well, I think you do. You have to, but but I think about a couple of things. I mean, there are these. I always think of low-hanging fruits. I mean, because we have to get step by step. We have, number one, we have to realize we can't just jump 20 steps ahead as much as we want to. It's okay to go slowly as long as we reach our end goal. And also, we have to celebrate our small wins because that's very critical until we actually achieve the true north. But for example, I think journals could really have special editions once a year or twice a year, maybe once a year, specifically focused on diversity and disparities research. So basically, it encourages um, researchers to submit to that special edition, especially journals with high impact factor, where sometimes what drives many of these journals is the newer elaborative therapies and newer biomarkers and things like that. So have a special edition for the disparities research. The other thing I actually think is a low-hanging fruit is for open access. I mean, you know that with open access, these articles are going to be widely read, but sometimes they're very expensive to publish in an open access format. And potentially, you could say, well, for disparities research, for qualified papers, the open access is either free or potentially is significantly subsidized, because it's really addressing a topic that is so vital and is so important to what we're trying to actually do. And I think trying to have the journals on editorial board level or administrative level to partner with advocacy groups and groups that are really helping educating patients and providing patients with access to whatever it is really key. It is something that we actually can do. And the last comment is mentoring. I think there's an opportunity for the journals because it usually has top leaders in every discipline that are making decisions on peer-reviewed papers and biomedical research. And we all know in academic medicine, you live and die by the impact factor, the H index, and how many papers you wrote. So if we really promote this and encourage this and say this is actually pretty good, that's actually wonderful. We have to really celebrate some of the good things. I don't know if you remember, Rumu, in 2020, at ASH, the American Society of Hematology, we had a plenary session about disparities research. It was great. It was again, it wasn't talking about solutions, but it was a paper that was the first author was Tina Bavana, and she's currently at WVU, was at Ohio State at the time, and she talked about acute myeloid leukemia and the fact that Black patients under the age of 60 with AML have significantly worse prognosis despite how much we celebrate AML, right? AML, we have so many new therapies doing great, everything is wonderful, but we saw significantly poor prognosis. And that did not necessarily, when you adjusted for confounders, the biomarkers or the mutational burden between various AMLs did not explain necessarily why this was the case. So that was made it to the plenary session at ASH. So it's good to actually see that, and we should celebrate it. That honestly, I think 10 years ago probably it wouldn't make it. We'll probably make a poster, maybe an oral presentation, but I think that was an acknowledgement for societies that this kind of research will earn you a podium presentation at the highest level of scientific rigor, and that people will take notice of that.
Thank you. And I think even the first, one of the papers I was presented this past ASH also looked at that kind of disparities research. But as we finish, Chadi, you got about 2 minutes. And one of the things that you've done very well is talking about toxic exposure and how big companies could actually harm people. And, you guys dealt with that from a legal perspective. And there is a growing movement that is beginning to wonder whether there will have to be a legal perspective to this whole concept of disparities in oncology research. Now, you do not have to answer this question, but I'm just putting it out there because you have dealt with something like that from a different perspective.
Yeah, of course. I think obviously I'm not really an expert in any legal matters except what I watch on Netflix for legal documentaries. But I don't know if that rises, Rimu, to the legal standard in the US that if you have a clinical trial, let's say, and you enroll 10% underrepresented minority, 90% Caucasians, I don't know if that represents an illegal activity. I think an illegal activity would be, if you manage if your treatment obviously differs based on race and ethnicity, that's obviously illegal and unethical. But that's a different scenarios. I think our goal should be if if you're a researcher and you are conducting research, and if your goal of the research is to help people, which should be really the true north of every researcher, I hope, not just to be promoted to a professor and get a high H index. At the end of the day, it's about the why you're doing this. Are you helping people who need your help? That individual needs to be held to the standard that you need to help all persons equally. And to do that, did your research address the elephant in the room? And if it didn't, we're not going to really accept your paper, and we're going to tell you why, and probably you could do better the next time around. But I do think you ask very provocative questions because you always do. I've known each other, we know each other for 25 years, so I know you always do. And it's a very important question. And I think you're making me ponder. I'm not really sure, but I think it's certainly something to think through.
All right, maybe we'll be talking soon. Again, thank you so much, Adi. I knew you were going to deliver last minute. You know, appreciate your friendship, appreciate who you are, and everyone here is clapping for you. So
right.
stay
Thank
around
you.
for the Q&A if you can.